So it's the 20th anniversary of the Center for Medical Humanities and Ethics.
That's amazing.
Yes.
You know, I think that we started the same year too. Like I started medical school and you started at the CMHE.
That's right.
Yeah.
And you were one of the first students to take my second year literature and medicine class. You were I wouldn't say a guinea pig, but you were in that brave first cohort.
A very, very lucky cohort. You know, when I would tell people I was taking a literature class in medical school, people would be like, why? What would you say to somebody who asked you a question like that? Like, what does literature have to do with medicine?
Okay, that's a beautiful question. When we look at stories over time, we see people's kind of moral and ethical change on a grand scale. And so like classically, novels like Middlemarch, which has a physician main character, allow you to see how the small decisions you make at any individual moment affect the whole course of your life. And so I like using literature to help students imagine their lives in medicine. In general, with my humanities teaching, I'm always trying to create a reflective space because y'all do so much. You're out in the world, you're studying, you're at the free clinics, you're doing your community service learning projects, you're working on your global health projects. And with the humanities, I really try to make a space for the students to make sense of it all. I mean, that's my hope.
Yeah.
What was it like for you?
It was exactly like that. It felt like this lifeline in the middle of a year where we're kind of doing medical school at home, right? We were taking classes over Zoom, but we had this little window where a group of us could talk about what medicine meant to us, why we still wanted to be doctors. It gave us this place to imagine ourselves in other people's shoes, which I think is also really, really, really important as people training to be physicians. And it gave us a connection with each other and to find people who are thinking about some of the same things. And we learned from you, but we also learned from each other.
So Yolanda, you have been a big part of the heart of the center since you joined as a medical student. And you've been involved in so many things. What has been particularly meaningful for you?
One of the reasons I really wanted to come here was because of the faculty student collaborative clinics. I came in and I knew I wanted to spend a lot of time there. The first chance I got, I went and I volunteered at the Haven for Hope Skin Clinic, which is this clinic where students and faculty provide free skincare to people who are experiencing homelessness. And it was such a powerful moment for me because at first I was absolutely terrified because I did not know what I was doing, of course. It was also this reminder about why I was here in the first place. I mean, it's very easy to kind of get lost in the studying and the minutia, and it's this really amazing reminder that really we're here to learn to take care of patients.
I think physicians are natural storytellers and hearers of stories. It's really the heart of the work that we do. Yeah. To hear a person's story and then within that story find a need and a way of assisting, right? A way of helping. So often here in San Antonio, in Galveston, where I trained as a medical student, in Texas in general, in academic medicine, we are caring for the most vulnerable people sometimes in the world. When I think about caring for, immigrant kids who were hospitalized because of starvation or injury in the process of migration, it's hard to imagine a human being more vulnerable than that. And when we tell a story well, we show the person as a fully human member of society and an important part of the world. And that is something that our society needs so badly right now. We need to recognize each other. We need to see each other and reach out to each other. And storytelling is just a way of inviting people into the lives of others, inviting people to see others who they might not ever get to interact with face to face. As physicians, we do. We do get to interact face to face with all kinds of people in all kinds of situations. And to invite everyone who might read a story or hear a story into that world for a moment, I think it deepens all of our humanity and all of our connection as a society. So it's a really big goal, right? It's big work of trying to build human connections across barriers of identity over time. And it's also very small, just telling a story.